Hello, I'm Dr. John Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm a consultant psychiatrist at the New Farm Clinic, which are both Ramsay Health Care facilities. Today I am here to talk about old age psychiatry. In older age, if you're developing a psychiatric or mental health problem, it's very important that your family, particularly your spouse or your carer, is involved in your care. They will be very worried about you. They might have noticed a change in your behaviour or a decline in your functioning. They might be concerned your memory's not as good, or you're not socialising as much as you used to, or you're lacking initiative and not starting new things, not enjoying things. So they might be concerned about a change. So they might have noticed changes before you do. So they might want to take you to the doctor, might want to talk to someone else about your problem. So often the relative will go to a doctor and say, my spouse or friend is not functioning as well, so what's going on? So they're often involved in the assessment phase, and then in the diagnosis. It's important your relatives understand your illness in old age, particularly if it's dementia, so that planning can be made for the future. In the future, it's important that your relatives' health is looked after as well. So if you're living with your wife or husband, we just want to make sure that they're not getting stressed, because we don't want them to feel they are going to be burdened by illness in their family. So we know that carer distress is something that predicts the outcome for your dementia. So if your carers aren't distressed or upset, then your health is going to be much better. So we really have to make sure we're helping carers, and we have to make sure that they're involved in the support network in the longer term. So that might be individually with their treating doctor or their hospital team that's looking after the patient. Relatives might come in. There might be relative groups within the hospital that support relatives of family and friends who might be mentally unwell in their older age. So we access those things, those support groups, but also in the community, we advise that if people have got dementia, that they contact their local Alzheimer's Association, for instance, and they're a wonderfully supportive group of people who can advise on how to talk to your relative with dementia, for instance, or how to care for them in the longer term. They can help you predict the future by, you might be able to talk to someone who's had a relative with dementia for a number of years, for instance, and they might be able to help you through the process of who you need to talk to, what sort of accommodation you might need, or what help you might want at home. We know a lot of relatives want to keep their relative at home, even if their dementia is getting worse. People want to be in their environment, and it's very important to organise that relatives know these facilities are there for them to help them, so that their relative can stay at home for as long as possible. When a person in older age might be developing dementia or has dementia, they might have problems communicating, and either they notice this problem communicating or their relative notices that it's a problem. We often advise people to make a diary or have a calendar where they can, which is easily seen and easily noticed, where they can write things down, because we know that helps memory, to be able to write things down and to know where that is to go and look for it. We often advise people in older age to have an emergency alarm system, for instance, so they can contact their relative as soon as possible if they're upset or they're distressed or they have an accident. It's often memory jogging which is important. So basically, if someone wants to remember an appointment, for instance, their relative might tell them when the appointment is, and might also tell them, draw a picture where they're going, for instance. So they might have a picture to remind them, as well as the actual time. So sometimes to have a number of inputs to help your memory is a good thing. So memory jogging is a good thing. To keep exercising your memory is a very good thing when you have dementia. So doing crosswords or word games or word puzzles. Just reading the paper, if you can read the paper, is a very good thing to do. Discussing current affairs, or just talking about having discussion groups, or exercising your verbal skills as much as possible is very important. So we advise patients to do that. We also advise relatives that when they're talking to their loved one who has dementia or early signs of memory problems, that they keep messages as simple as possible and they don't become frustrated themselves, because that's the risk, that it is frustrating initially. Maybe have a notice board where they put up a list of things the person should do for the day so they can tick them off each day. Simple things like making sure people have their medication organised, for instance, pill boxes or blister packs for their medications are important. And just a routine for the day. So the relative might say, here's, we're going to help you with your routine for the day. So up at this time, during the morning, we're going to do something routine every day. So to keep a repetitive event going every day is also a good thing, because people feel comfortable when they're safe and have repetitive events occurring. And I think for the relative, the most important thing is to realise that their loved one is not forgetting things on purpose. It's a process that's happened in their brain. They can't remember an event, so that it's important for the relative not to become frustrated by this process and too upset by it. And I think it's also important for relatives to speak to someone about their distress if they are getting frustrated. So it's important they might speak to their own doctor, or they might seek a community organisation like the Alzheimer's Association for support in this setting. And it's also important that people talk within the family as well, that they do. Brothers talk to sisters and mothers talk to fathers. Everybody talks to the family about what's going on, so that messages passed to their relative with dementia are consistent. So there's not too many confusing messages going to the person with a memory problem. In older age, some people have dementia, but they also have a range of physical problems as well that they've developed in older age. So they might have painful conditions like arthritis or fractures that might be incredibly painful. Now, people with dementia sometimes can't report that distress properly because they might have lost the capacity to communicate, they can't find the words. So it's very important that as doctors we're aware that people can't find the words for that, and if they're in a lot of pain, it might make their dementia worse, might make them more confused. Some people with dementia forget to take tablets, so they might forget to take tablets for their blood pressure or their heart problem, which then leads to that problem getting a lot worse because they're not taking their treatment. It's also important to understand that people with dementia do get physical problems because of the dementia. So if you've got Alzheimer's disease, your physical condition does deteriorate towards the end of that dementia. So you may not be able to walk as well, you don't have the physical strength you used to have, and you can decline in your overall physical condition towards the end of your life with Alzheimer's disease. So the other common cause of dementia, which is vascular dementia, you have stroke, so that might affect part of your brain that controls other things. So either whether it's hearing or sight, or your capacity to do physical activity might be affected. You might get a limb weakness from a stroke. So there is an interaction between the dementia and the physical symptoms. If you've got Parkinson's disease, for instance, and dementia, then you have to maximise the management of both conditions. And so we have to monitor those conditions very closely. In older age, it's very important for your mental health to use your intellectual capacity as much as you possibly can. So that might involve reading tasks, it might involve simple puzzles like crosswords, Sudoku, playing cards like bridge, or those types of games that keep your brain as active as possible. Conversation or social activity is very important in older age, particularly after you've retired and you've lost your work setting. It's very important you keep your social life going in old age. So you might join new clubs or interest groups, for instance, University of the Third Age, or an organisation that involves discussing social activity or intellectual tasks. People want to enjoy themselves, so they might travel, or it's very important to plan ahead for the future. And so plan travel, plan interesting things to do, and to keep as physically well as possible by exercising. Even into your older age, you can still keep exercising, which is very important for your mental health as well as your physical health.